Good evening, teacher. I am Africa Holder, and, and my final test of oral explanation is about the theme gonorrhea. Teacher Librada Saucedo. Gonorrhea is a sexually transmitted disease, STDs, that can infect both men and women. It can cause infection in the genitals, rectum, and throat. It is a very common infection, especially among young people ages 15 to 24. Anyone who is sexually active can get gonorrhea. Gonorrhea can cause very serious complications when not treated, but it can be cured with the right medication. You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. The only way to avoid STD is to not have vaginal, anal, or oral sex. If you are sexually active, to lower your chances of getting gonorrhea is being in a long-term, mutually monogamous relationship with a partner who has been tested and has negative STDs result. STDs stand for sexually transmitted disease, and use also latex condoms the right way every time you have sex. The symptoms to know if you have STDs in men are burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles. Symptoms in women can include painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. The symptoms in women can be mistaken for bladder vaginal infection. The women with gonorrhea are at risk with developing serious complications from the infection. In both men and women, rectal infection may cause the following symptoms: discharge, anal itching, soreness, bleeding, painful bowel movements. If you have any of these symptoms, you should go to your doctor immediately, and the doctor will do a urine test or swab, may be used to collect samples from the throat or rectum. In the man's case, the doctor will collect the sample from the urethra, the urine canal, and the woman's cervix, opening the womb. Untreated gonorrhea causes serious and permanent health problems in both. In women can cause PID, pelvic inflammatory disease, that will be forming start that block the fallopian tube, ectopic pregnancies when the baby is outside the womb, infertility, long-term pelvic or abdominal pain in men, painful condition in the tubes attached to the testicle. It causes the man to be sterile, and in both may also increase getting HIV, the virus that causes AIDS. The treatment and care for STD is a single dose of 250 milligrams of intramuscular ceftriaxone and 1 gram of oral azithromycin. It is important to take all the prescribed medication for STDs. You cannot share your medication with anybody. When treatment is finished, you have to take another test to see if you were cured, and you have to wait 7 days more to have sexual activities again with protection. Be safe and take care of yourself. Thank you very much for paying attention. I hope you enjoy my presentation.